Welcome to Quick Course Digest. Today, we're diving into the huge and honestly super important world of public and community health. We're going to explore the systems, the history, and all the future challenges that shape the well-being not just of you and me, but of entire societies. Okay, let's just jump right in with a big question for you. What truly keeps a community healthy? I mean, when we think health, we usually picture a doctor's office, right? An emergency room, maybe. But what if the things that really keep us healthy are, well, all around us? Things like clean air, safe neighborhoods, and just fair access to care. Today, we're going way beyond individual medicine to look at that bigger picture. And to really wrap our heads around this, we're going to break it down into 4 key parts. First, we'll take a look back at how our health systems even got here in the first place. Then, we'll tackle the biggest hurdles we're facing today. After that, we'll connect the dots between our planet's health and our own, because they're totally linked. And finally, we'll get into the tough ethical questions that guide us toward a healthier future for everyone. So, let's start at the very beginning. To really get a grip on the complexities of our health landscape today, we've absolutely got to look at its roots and see just how far we've come. It's kind of wild when you look at the difference, right? Before the 1800s, healthcare was literally a family thing, done at home. Women were often the main caregivers, using knowledge about herbs that was passed down for generations. The big medical idea back then, the ancient Greek humoral theory, this belief that your health was all about balancing 4 fluids in your body. Doctors were pretty much a last resort. Now, fast forward to today, and we have this massive, professional, hospital-based system built on science and evidence-based practice. It's a whole different world. And this timeline, wow, it really shows you the game-changing moments that reshaped American healthcare. In 1964, the Civil Rights Act made it illegal to discriminate in hospitals. Just a year later, bam, you get Medicare and Medicaid, creating the safety net for the elderly and for low-income families. Then in 1970, the EPA officially links protecting the environment to protecting our health. The 90s gave us the Patient's Bill of Rights, and of course, in 2010, the ACA expanded insurance to millions. Each one of these was a huge shift. And all of that history brings us right here to today, where we're facing a whole new set of incredibly complex, interconnected challenges in public health. Get ready for this number, 80%. Projections are showing that by the year 2050, 80% of the world's older population will be living in low and middle income countries. That is a massive, monumental shift, and it presents this huge challenge for healthcare systems that are already stretched thin. It's forcing us to totally rethink how we support healthy aging on a global scale. And then there's another huge hurdle, the digital divide. I mean, we live in this super connected world, but not everyone has the same access to digital health tools. Take post-Hurricane Katrina New Orleans as an example. Even all these years later, the city still lags behind the national average for broadband internet. And what that means is that whole communities have less access to telehealth, to their own electronic health records, or even just reliable health info online. It creates these really serious gaps in care. And, we absolutely have to talk about systemic racism as a public health crisis. This isn't just about individual prejudice. It's about the policies, the practices, and the unspoken rules that are kind of baked into our institutions, like healthcare, housing, you name it, that end up creating and continuing disadvantages for some racial and ethnic groups. And that leads to major health inequities. And this isn't some abstract theory. This is real life. This is a pretty stark example. Multiple studies have confirmed that Black patients are systematically undertreated for severe pain compared to white patients, even when they show up with the exact same symptoms. And a lot of this is driven by these deeply rooted false beliefs and biases within the medical community. And the result is real unnecessary suffering and, understandably, a deep mistrust in the healthcare system. Which actually leads us perfectly into our next big topic. That undeniable link between the health of our environment and our own health. They aren't separate things at all. They're really just 2 sides of the same coin. So let's break down how this works. It's kind of like a chain reaction. It all starts with human activities, right? Especially burning fossil fuels for energy. This releases greenhouse gases, like carbon dioxide, up into the atmosphere. And those gases act like a blanket, trapping heat and causing global warming. And the direct results of that, you guessed it, more extreme and more frequent weather. We're talking devastating heat waves, more powerful storms, and destructive wildfires. All stuff that has an immediate impact on public health. And these impacts are incredibly personal. Air pollution from burning fossil fuels directly makes things like asthma and heart disease worse. Extreme weather can contaminate our water, leading to outbreaks of diseases like cholera. Those crazy heat waves can cause heat stroke, especially in the elderly and people who work outside. And as ecosystems change, bugs like mosquitoes move into new areas, changing how diseases like malaria and dengue fever spread. And here's a really key thing to remember. These hazards aren't spread out equally. The legal case of Louisiana versus the EPA is a really powerful example of this fight for what's called environmental justice. The state challenged the EPA over industrial pollution that was unfairly harming low-income and minority communities. It just highlights this ongoing struggle to make sure that everyone, no matter their zip code or their race, has the right to clean air and clean water. Okay, so this brings us to our final and maybe our most important section. As we look to the future, we have to be guided by strong ethical principles to protect people and get ready for the challenges that are definitely coming our way. Let me start with a question to get you thinking. Could your cells be used for research and for profit without your consent? I mean, imagine you go to the doctor and, without you ever knowing, a part of you is taken and used to create medical breakthroughs that make billions of dollars. Does that seem right to you? This exact question is right at the heart of one of the most famous cases in all of medical ethics. Back in 1951, a Black woman named Henrietta Lacks was being treated for cancer. During her treatment, doctors took a sample of her cells without her consent. Now, her cells, nicknamed HeLa cells, had this incredible ability. They could replicate forever in a lab. They became a cornerstone of modern medicine, used in everything from the polio vaccine to cancer research. And yet, for decades, her family had no idea, and they never received a dime for this world-changing contribution. The revelation of her story sent absolute shockwaves through the scientific community and led to some fundamental changes in policy. Now, the idea of informed consent is everything. You have to be told exactly how your biological material might be used, and you have to agree to it. Institutional review boards, or IRBs, were set up to provide ethical oversight for all research involving humans, and privacy protections got much stronger. Her case was a painful but absolutely necessary wake-up call. So, as we look ahead, public health is facing three huge threats. We've already talked about climate change and its growing impact. Another one is workforce burnout. The insane pressure from crises like the COVID-19 pandemic has led to widespread exhaustion and shortages among public health workers. And finally, infectious diseases are a constant threat. With global travel, a disease anywhere can become a disease everywhere, like overnight. But it is not all doom and gloom, not by a long shot. There is some incredible innovation pushing us forward. Telemedicine is breaking down barriers to care, especially for people in rural areas. Data modernization is letting us track disease outbreaks in real time, which is a total game changer. And maybe most importantly, there's a real shift toward community engagement, which empowers people to help design the health solutions that will actually work for them. So we'll end right where we began, with a question for you to think about. After everything we've talked about, from history and policy to ethics and the environment, what do you think is the single most important thing our communities should do to prepare for the next public health crisis? Because there will be a next one. The answer isn't simple, but just thinking about it is the first step toward building a healthier future for all of us.